Channel. All right, well, welcome everybody. We're going to talk about exosomes and aesthetic medicine today. So first, I'm going to share my presentation so everyone can see it. Hold on one sec. All right, hopefully everybody can see that. Okay, super. So I'm Dr. Heath McAllister. Nice to see you all. Today we're going to talk about exosomes and regenerative and aesthetic medicine. So first, we're just going to talk a little bit about what exosomes are. So at a base level, exosomes are signaling molecules. They're a type of signaling molecules that exists within our own bodies right now called paracrine signaling. And it's a way that a neighboring cell can communicate with other neighboring cells by pinching off a little bit of its cell membrane and containing a little bit of its microRNA, which is the signal for each of our cells to produce certain things like proteins. So these are very, very tiny little vesicles released by cells. They act as messengers and they contain proteins, lipids, microRNA, and regular mRNA. So, and these are really the instructions, the how to, what is a cell supposed to do? Cells don't operate on their own. They operate via instructions that they're given, usually from the nucleus or from other biologic signaling. And so exosomes are those little signaling molecules, one of the ways that cells communicate with neighboring cells. And that is how they coordinate repair and regeneration. So you have a source cell. A little bit of that source cell buds off from its cell membrane, goes into circulation, and then merges with the target cell's cell membrane, delivers that payload of instructions to the cell, and then that cell exhibits those new effects. So this whole process, you can get exosomes from various different ways. We're going to talk about the pluses and minuses from different sourcings of exosomes, but the quality of the mRNA and the microRNA, that's the really important thing to keep in mind here is that all exosomes are not created equal. If you take exosomes from your own body, from your own stem cells, let's say, they're not the same vibrant beginning of life stem cells and exosomes that you get from, say, placental tissue. So I'll revisit that in just a little bit. So why are exosomes therapeutic? Well, they're delivering that payload, those instructions to your cells to rejuvenate and to heal. And they're doing it without giving you foreign live cells. So that's really important. So when stem cell treatments became really popularized, they were taking live stem cells from placental tissue and introducing them into circulation. The issue with that is that those stem cells are not your stem cells, and all of our cells have a name tag associated with them called MHC. That major histocompatibility complex, it says, I am Dr. McAllister cells, and you are Jane cells, and you are Richard cells, and they don't generally play well together. If your body sees foreign cells show up in your bloodstream, it sends a big alarm up and you get an inflammatory response and your immune system comes in to kill those cells. So if you get cells from placental tissue, they don't live in your body very long, and so they're not going to do that much good. Versus exosomes, they're tiny, they're fragments. They don't have that cell signaling identifier on them, so they're interchangeable between people, and you can get them from other sources. Your body perceives them as the exact same as yours. So that's what this means down here, low immunogenicity. That means exosomes do not trigger an immune system response in a negative way. The exosomes are tiny, so they can cross biological barriers. So that is like we have this barrier in our brain called the blood-brain barrier, which protects us from a lot of damage and toxic compounds and potentially can block helpful things from getting up into the brain. In this case, the exosomes are so tiny, they diffuse through that blood-brain barrier and can stimulate neurologic healing. And they activate endogenous healing pathways. So they don't do the exosomes are not themselves doing the work. They are stimulating your body to heal itself. So they're the magic messenger, the magic instructions. So what ways can you use exosomes? Well, all kinds of different ways. Basically, anytime you have tissue damage, you want to stimulate tissue healing. So musculoskeletal repair, we use this to help heal up shoulder injuries, when torn meniscus in knees, hip arthritis, twisted ankles, any kind of musculoskeletal problem you can think of, exosomes can potentially be a huge benefit. Now, some tissues are degraded past the point where surgery may be your best option. And if you're looking for an option before surgery, exosomes would be a strong consideration. It's really on a case-by-case basis whether or not your tissue will respond and be able to heal up. Like I said, there is a point where tissue gets degraded too much and you may need something like surgery. But for many cases, exosomes can be wonderful for healing up those injuries. Neurologic support, brain health. Well, boy, that brain is something we really can't live without. Everything from our mood to our memory to our energy levels to our personality. Brain health is so critically important, and we've had an epidemic of brain diseases, everything from Alzheimer's and dementia to autoimmune conditions that affect the brain, like MS and Parkinson's. So exosomes represent an incredible non-pharmacologic intervention that really does stimulate neurogenesis, so the production of new brain cells, the healing of brain cells. Exosomes do that, and they pass up through that barrier with no issue. Immunomodulation. So this is something the exosomes are actually very famous for. So there are two ways your immune system can go awry. It can be underfunctioning, right? Where you get colds and flus too often. Our immune system is our protection system in the body. It's our police and our fire department and our all the different regulatory systems that keep a city functioning. Well, we have a version of that in our own bodies. And your immune system is designed to always function at a low level. And at certain points, when you get an infection, it functions at a high level. So some people have lower functioning immune systems. Other people have their immune system has gotten triggered into an excessive activity. So that would be things like we call autoimmune diseases, things like Hashimoto's thyroiditis, rheumatoid arthritis, right? The very connective tissue disorders. There's all these various different versions of immune attack on our own native tissues. Well, exosomes are well researched to help reset that response. So they're not immunosuppressive per se, but they're immunobalancing. They help balance out excessive responses. Or if you're having an underfunction, they could potentially help boost your normal immune system's response. Cardiovascular and metabolic health. Exosomes are also well studied for that. So if you look at markers of heart inflammation, there would be things like high sensitivity CRP, right? These markers that show that the heart might be acutely inflamed. If you give exosomes, exosomes have been shown to lower those inflammatory markers, so thereby supporting those tissues. So heart health, 100%. And I would say that goes for all our organ systems, your liver, your lungs, your kidneys, your brain, kind of the big stuff, all the important stuff we can't really live without. Exosomes diffuse into those tissues and stimulate that self-healing process. So there are many more actions than are listed on here because the actions are potentially unlimited. So for the skin specifically, and I would like to qualify this a little bit, we talk about musculoskeletal repair. We're injecting the exosomes actually into a damaged area. When we talk about neurologic support, you're giving an IV infusion to get those exosomes into circulation to get up to the brain, right? So we're talking about these are very much internal processes. You're delivering the exosomes in some form or fashion internally. In the skin, we're really looking to affect that outer layer of tissue. Now, if you do an IV treatment, I don't expect it to really do that much for your skin. To really treat the skin, you have to embed the exosomes in that dermis layer. It also is for that same reason that you couldn't just put exosomes on topically, right? The topical layer of our skin is called the epidermis. And largely the epidermis are dead cells. You don't think about that. You don't think about your face as full of dead cells, but basically all this tissue you can see on my face, these are all dead cells. Beneath that, several layers, there are the living cells. So if you want to do an exosome treatment for skin improvement, you really have to embed them into the dermis, deeper into those tissue layers. And we have various different devices that we use at our clinic, like microneedling machines that help embed the exosomes in. Now, once you do that, what do? Well, you get all of this activation. Fibroblasts. So what is a fibroblast? Well, that is a white blood cell that produces new connective tissue. Okay. So they're everything from helping, produce normal healthy skin to scar tissue when we have injuries and so forth. But those fibroblasts are the looms of the body. They produce threads of new tissue. Collagen production. So we've heard a lot about collagen in the social media and so forth. Collagen is the protein content of your skin. It's basically the matrix of your skin. It's what makes skin strong and tight and plump and juicy. That is collagen. So inducing collagen, or what they call collagen induction therapy, that is what exosomes do. Along with the microneedling treatment, you get a stimulation of more production of collagen. Elastin. So elastin is that elastic layer of your skin. That's that elastic recoil that over time we lose, and that's how we get wrinkles and we sag. It's where we've lost that elastic recoil of our tissues, and exosomes support that. And then there's term angiogenesis, which means the production of new blood vessels. So basically, in order for tissues to heal and to stay healthy, you need to have good flow coming to and from them. And exosomes do stimulate new blood vessel development. So collagen skin quality. So again, we talk about fibroblasts. So the exosomes stimulate fibroblast proliferation. So more production of these cells that lay down those threads of new tissue. You see an increase in these various different types of collagen, collagen 1 and 3. You get improved elasticity and thickness, that plumpness of the skin gets improved. And you enhance wound healing and texture. Something else that exosomes do that we didn't really get into is that they are useful in helping soften and reabsorb scar tissue. So those are some treatments that we have done in our clinic before when people have, say, stretch marks or old acne scarring. If you microneedle and use the exosomes to embed into the skin, you stimulate scar tissue resolution and new healthy tissue to be produced. So other things that exosomes do, they reduce oxidative stress. So this is a very general term. We use it broadly in medicine. Oxidative stress, oxidative damage. What does it really mean? Well, basically it means a type of inflammation or toxin exposure that causes cell damage. So it can be anything from chemicals, bleach would be an example of something that is oxidative, right? Strong sunlight, radiation, harsh chemicals, those are oxidative forces. So reducing oxidative stress on your cells is important. You need to kind of give them a leg up in order for them to start healing themselves. Exosomes modulate senescence pathways. So senescence is a term that we use for cell lifespan. And if you can modulate those pathways and literally lengthen that time, you're literally that is anti-aging. That is increasing lifespan of cells, and that is something that exosomes have the potential to do. Mitochondria. So many of you may have heard of what mitochondria are. They are the powerhouses of the cell. They produce the elemental packet of information, or sorry, energy that our bodies run off of ATP. And most of that, the lion's share of that, is produced in our mitochondria. And so if you get improved mitochondrial signaling, you're going to have more efficient ATP and energy production. So, along with healing our organ systems, the mitochondria is called an organelle. That is a little baby structure within each of our cells. So the exosomes have this really broad reach. And exosomes promote youthful gene expression profiles. So if you look at, what genes, we all have our genes in our body, they're set from day one, but which genes get expressed, which genes are active, right? Active and actually your body taking instructions from those genes, that can shift with exosome treatments. So generally speaking, when we do an exosome treatment, we see lower inflammation, win all around, improved mitochondrial function, again, more energy. If your body has more energy, it does all of its microscopic processes better, and you actually may subjectively feel more energy. Increase in DNA repair. DNA are those individual instructions in the cell that tell a cell how to function on a base level. When DNA gets destroyed, the cell can no longer replicate. That is cell death. If you can repair those mechanisms, then the cell actually lives longer and you get greater intracellular communication. So all of these are basically ways that we're essentially reversing the aging process. So why are exosomes the future of medicine? And I would just say in medicine in general, not even just aesthetic medicine, but the capacity for exosomes to heal various different disease processes. I haven't found anything like it in my medical practice. So, to highlight some benefits, they are cell-free regenerative therapy, which means you're not receiving foreign cells. Foreign cells can be a problem for the body. Some people have really strong negative reactions when you put foreign cells in the body. And we know that any foreign cells eventually are going to die anyways. So, what's the point? Why would you give foreign cells? Um, Precision signaling versus blunt stimulation. This is exosomes, that payload that they're delivering, the microRNA, the lipids, and so forth. That is very specific rejuvenative signaling. It's not just giving your body more energy or, giving you more hormone output. It's very specific in rejuvenating, telling those cells to rejuvenate and to heal and to essentially function as if they were younger cells again. Microneedling treatments and lasers, so you can use exosomes in combination. For instance, the microneedling, that's how we get the exosomes into the dermal layer, right? Past the epidermis into the dermis with microneedling pens and different devices like that. Some people also will use lasers. When you do a laser treatment, you are almost also producing, little changes in the skin to stimulate collagen induction and so forth, and you can use exosomes at the same time. But really, they're the next generation of anti-aging medicine. I think we're only going to be using this term and this type of medicine for the next foreseeable future because it's such a strong way to rejuvenate your tissues. So, in terms of, rejuvenating specific processes, damaged areas, sports injuries, arthritis, that is well established. But then brain healing and heart support, I think eventually they'll be able to rejuvenate organs like pancreases and type 1 diabetics. I think that's on the docket. That's going to be happening in our lifetimes, probably in the near future, in the next 5 or 10 years. So this is me. If anyone is interested in having a free conversation with me to see if exosomes might be a good fit, you can go onto my website there. You can schedule what's called an exosome discovery session. And that's where I block out a half hour to hear about you, what your health goals are, and if exosomes are a good fit. And rarely are people not a good fit, but I will tell you the patients that don't really qualify for exosome treatments for us from a liability standpoint would be if someone has active cancer. There's just a lot of things we don't do in cancer. Exosomes, there's no evidence that they facilitate cancer growth, but we kind of don't give a lot of things in cancer, like hormone therapies and so forth. We're pretty hands off. So if someone has active cancer, to me, that takes them out of the running for our clinic. Um, but that's mostly it. Exosomes are incredibly safe. They're bioidentical for what we produce in our own bodies. And used topically, they're very safe. I mean, you're not even having a systemic effect at that point. You're really just stimulating the epidermis, the dermal layer to produce a healthy epidermis, to exfoliate, to induce collagen, to produce more type 1 and type 3 collagen, elastin, all of those things that we talked about that really produce healthy, glowing skin. That is exosomes topically. It's an incredible advancement. And you could think about it like a vampire facial, but to me, it's like a vampire facial times 10 in terms of its ability to heal the skin. So that is my presentation. If we have any questions, you guys can go ahead and rattle them off to me. We've got another few minutes. So if anyone has any questions, I'd be happy to take some right now. And if not, that's totally fine too. Super. Oh,
What are the negatives of this?
yes, negatives. So, Patrice, now can you tell me negatives in terms of topically or internally or both?
All.
All. Okay. So there's not really a down. Well, I would say for me, the biggest downside potentially could be, uh, let's say someone spends a bunch of money and they don't get what they want out of it. There's that to a certain extent. Exosomes are a biologic wild card. We know there's going to be some deep healing that happens, but is it going to do exactly what you want them to? Topically or internally? Um, I haven't ever seen them not function for what I want them to do, but let's say someone in kidney failure and exosomes are researched for kidney failure. You could get a treatment. You could see your kidney function improve a little bit, not as much as you want, not fully healing. So there could be a partial response, I guess, Patrice. You get a partial response, but maybe not all that you hoped for. And I'm really upfront with that when I talk to patients about, you know, that's a worst case scenario. That's a risk is that you pay money for a thing that you hope to do a certain thing, and it maybe doesn't fulfill all of your hopes for that treatment. So that would be a risk. Otherwise, like I said, they're bioidentical. This is a very similar treatment that already exists in your own body. It's just giving you more vibrant signaling molecules. So the risk is really low. Every now and then, someone could get, say, like a herpes outbreak. Let's say you're someone that gets cold sores. In the process of immunomodulation, which is a term we talked about in the presentation, you potentially could allow that latent viral infection to kind of pop up. So that has happened a handful of times, not even in our clinic, but it's published. So we are always upfront if someone has, chronic viral infections or they tend to have herpes infections or shingles outbreaks, that is something we bracket that treatment. We usually do some antiviral stuff along the same time with it. But in terms of, you know, the topical treatment itself has the same potential side effects as any kind of topical microneedling treatment in that you're going to have little microscopic holes, all through your face for a couple of days. Your pores are going to be very open. You're going to look like you had a mild sunburn. It's going to take a week or so for that to kind of bounce back. So it's the same kind of topical risk that going to like laser therapy. You're going to get a little bit of micro damage in the short term to stimulate a big healing response. Otherwise, we don't really see any other negative side effects from the exosomes.
Thank you.
You're welcome. Any other questions that I can answer for you since you got me on the Zoom right now? And again, if not, that's totally fine.
How long does it last? Or how often should you have it done?
Good question, Paula. It depends on what your health goals are. So topically, let's just subdivide it. Topically, um, doing a topical treatment, I usually say do treatment, wait for 3 months, and see what you think. So like how much of a treatment response did you get? Did it resolve all your fine lines and wrinkles? Do you feel like you still have more to go? There's a question mark there. After 3 months is usually when we evaluate with either the internal treatment or the topical treatment. Was this treatment effective? Um, so for different patients, they might need more intensive intervention. Let's say I've got someone with Parkinson's disease, right? I'm probably going to have to do several treatments with them back to back, to really get enough brain healing to really calm things down. So generally speaking, we'd say that the treatment's going to last at least 3 months in terms of that healing process. So that remodeling and the instructions to your cells, that domino effect will at least last 3 months. But after 3 months, it kind of tapers off. So that's the time that we look at, like, okay, did you get what you wanted to out of this? Yes or no? If yes, but partial response, maybe there's another treatment in your future. In terms of, generally speaking, it's like, how often should you get a oil change in your car? It's like, well, we all should be getting oil changes, every 3 to 6 months in a perfect world. So how often you do an exosome treatment, again, it's about your health goals, it's about your disposable income. There's a lot of things that go into it. Um, but you know, we are all built to break. We're all breaking down over time. The more that you give the exosomes, the more that you're pushing back against that breakdown process. So it's really a case by case basis.
Okay.
And we got a couple of questions that came in. We have two clinics in LA where we do the treatments, Maxine. The cost of the treatment depends on the concentration of exosomes we use. At our clinic specifically, with the sourcing that we have, our exosome treatments for a topical, for a facial treatment is generally around $3,000. And if you're doing an IV treatment, it depends on the concentration. The concentration that we either use 5 billion exosomes or 15 billion exosomes. And those prices corresponding are $6,000 or $8,000. And most of that cost is just getting the material themselves. What about the injections? So the IV treatments, that's the $6,000 to $8,000 range. That's where you're looking at the IV treatments. The topical treatments, the microneedling treatments are about $3,000. Super. Well, I want to thank everybody for tuning in. If anyone is interested for themselves or a loved one, oh, and sorry, Maxine, yeah, the injections into your joints, it's the same with the IV treatment. It depends on the concentration you use. It's either $6,000 or $8,000, depending on how intensively that tissue might be broken down and might need support. But that's basically the range. So, if anyone is interested in having an exosome discovery session with me, like I said, go to my website. You can sign up. We can spend a half hour going through you and figuring out, are they a good fit for you? Does it make sense for you? Is it something that may actually really be helpful for you? Are there any contraindications? We'll get very much more granular on that. But I really appreciate everyone's attendance, and I hope to talk to you all soon. Take care.
Thank you.
Bye
Take
bye.